Hello everyone. My name is Stephanie Obi, and I am a student of the TBRA 100 class. The title of my social media campaign is the Women's Initiative 2025, and the call and cause and purpose is to advocate for healthcare equity amongst minority women. So, the overview and the goals of this initiative, this campaign, is to address healthcare disparities faced by minority women, advocating for equitable healthcare access and informed support systems. This initiative emphasizes the critical need for addressing and understanding these disparities to foster better healthcare outcomes. And this is so near and dear to me because I actually want to become an obstetric gynecologist. And main reason why I wanted to go into that field is because there was a point of time during undergrad of college where I began to study and notice the disparities in the healthcare system when it comes to providing healthcare for women of color, women of minority, and African American women specifically. And I noticed the type of healthcare they were being provided and the treatment. And I began to look into the statistics of the treatments, and I noticed that some of them resulted in fatalities, and mainly because they were not being properly treated due to not being understood or cared for, and that motivated me to want to serve in that underprivileged community, to better serve and educate women of these issues. So some of my goals of my campaign, as well as sharing my social media calendar, the objectives, like I said, is to raise awareness of healthcare inequities that disproportionately affect women from minority groups by advocating for policy changes and aiming to make sure that women, regardless of the social class that they come from, they have access and the resources they need to support their health. And so some of the things I decided to do during the month of January to help advocate and better campaign and market this platform is one, going on Instagram Live on some days and just sharing foods for thoughts about women's health and some of the issues and things that people may not know about this topic. Other examples I had were to vlog me attending seminars, women health seminars, and seeing other women talk about this field and their interests as well as mine. Another would be to host panel discussions that I would post on YouTube as well, about women talking about the disparities in the health system when it comes to minorities. I also wanted to be able to go on Instagram Live and allow women of minority groups to share their experiences in the healthcare field and how they feel they've received or been treated in healthcare overall. So, and also I wanted to be able to post on my WhatsApp status as well as Instagram random fun facts about women's health. I believe all of these in culmination will be able to raise awareness and better educate people about this campaign and what we're all about. Of course, my target audience being women of minority, women in these healthcare disparities that are being affected, and of course, policymakers and healthcare providers who may fall into this category of not providing the proper healthcare to women of minority. And I believe that this campaign will help educate them on those areas and the fact that it does exist, and it's present and it's affecting the community. So to talk about my website and how it comes in and how it might help with advancing this campaign. So a lot of the focus on my website is just to be able to talk about things that are interested me and I find passionate about, and this being one of the women's health. And I believe I'm able to use this platform to talk about that and propagate this campaign. Specifically, I plan to use my blog session to post a lot of the information and media campaigns that I had mentioned on my calendar. such as the vlogs and of course podcasts hosted with other women in the healthcare field who have this same interest and feeling about women and their healthcare and the disparities that exist there. So utilizing that and posting videos and sharing content about those experiences, I would definitely be able to utilize my website to be able to accomplish that. So, as I mentioned, two of the main social media sites that I plan to utilize is YouTube and Instagram. I do believe that those are one of the biggest social media platforms, and they're able to span and reach a lot of people. YouTube, of course, is a video making website and allows us to create content extensively on information and things that we find important and fun and interesting to us. So being able to do things such as vlogs, video record discussions is definitely one way I'm going to utilize that to talk more about these disparities amongst minority women. When it comes to Instagram, it is such a fun way and everybody's into Instagram. Everybody's into it. Most people are. And I believe utilizing this app will allow me to reach people in a more engaging and more contact way, where they're able to see quick videos or quick tidbits and things about women and the things that they're facing in the healthcare field, women of minority specifically. Two of the hashtags that I would actually use are TWI25 and My Health Matters. And this is definitely centralized on the initiative, TWI standing for the Woman Initiative, the Women's Initiative, and My Health Matters, particularizing it to that woman, that personal woman who knows that their health care is important to them, and they want to be able to raise awareness as well. So just to talk about some of the sites, networking sites, and social media accounts that I plan to use. I did talk about Instagram as well as YouTube. Some of the resources that I now want to be able to utilize that I believe talked greatly about health disparities and how that, related to women and minority, first being the National Institute of Health. They actually have a department, a corporation known as the Office of Research on Women's Health, which focuses essentially on women's health and advocating for healthcare equity amongst minority women. It talked about a lot of the health disparities that I wanted to be able to touch on and reach in my campaign, and the difference in the health outcomes and the access to healthcare across different populations, groups of women, and the disparities and how they manifest in poor health conditions. And it reduces the necessary medical services that these women are able to achieve and receive, and can result in developing sicknesses and diseases over time. So that avenue, that specific site, was definitely a place and a outlet, a resource for me that I was able to utilize to gain more information for myself, and I wanted to share it with my viewers as well, so that they're able to utilize it to understand and receive more information too. Another site that I also focused on was the Racial Disparities in Women's Health blog from the Network for Public Health Law. And this allowed me to talk about the different contributing disparities, as well as the disparities that are existing amongst different racial groups, and the economic instability and the lack of education and systemic racism that occurs within these healthcare systems, and how they're manifesting. And so looking at this website and sharing it with you all allowed me to also expand my knowledge on that as well, and was a great resource for me to be able to learn more than I already do know about those disparities that are currently existing. Finally, I was able to look into the the Center of Disease Control, and they actually had article that talked about working together to reduce Black maternal mortality, which was something that first triggered me to really get into learning about women's health and wanting to go into this field of obstetrics and gynecology. It talked a lot about how these women, Black women specifically, are faced with these healthcare issues and experience mortality rates during labor, and that leading back to not receiving the proper health care and not being well educated about their health. And so this was definitely a resource that I found very useful to me, and I felt sharing it with you all as well will help increase the credibility and understanding of what is actually going on within the health disparity amongst women of minorities, specifically African American women. So collaborative partnerships, just being able to form with and collaborate with other organizations and healthcare providers. That one being, and I want us to actually focus on that, is the National Women's Healthcare Network. And that is actually a big organization located right in Washington, D.C. And it helps women who want to get into groups and do the things that I am doing right now. A campaign on a women's initiative that propagates women's health. They donate funds and money to individuals who want to start those kind of initiatives. And I definitely wanted to be able to collaborate with them and support their cause to talk more about women's health and how to better educate women and also help women understand those problems and issues that are existing in the minority community, and how for us to be able to solve this issue as a team, as a group of women. I finally decided that for my AI tool that I wanted to use was DAL-E. And I found that this tool actually helps create logos and cool graphics that can help, campaign and market your information even more effectively. And so I wanted to be able to utilize that for my campaign initiative to be able to create graphics and infographics and different types of images that would be able to better gravitate and captivate the attention of my audience to see the importance of this issue. I believe images and pictures definitely help communicate the message louder than words can sometimes. So I believe using DAL-E will be an effective way, that AI tool will be an effective way to be able to accomplish that. But with that all being said, I do believe the Women's Initiative 2025 campaign is one that will require a lot of work and dedication. But I do believe with the tools and layout that I have provided, it is possible to achieve that. And it is possible for people to have a better understanding and there to be raised awareness about those disparities in women's health amongst minorities and bridge that gap. Thank you so much.